Welcome. Have you ever heard of a condition called chylothorax? It's a rare but serious lung disease that involves the leakage of lymphatic fluid into the space surrounding the lungs. Join us as we delve into understanding this complex condition, from its causes to its management. So, what causes chylothorax? The most common culprit is trauma, such as chest surgery or injury. However, it can also arise from non-traumatic conditions like tumors, particularly lymphomas, that obstruct or damage the thoracic duct, the main vessel carrying lymphatic fluid. Congenital abnormalities, infections like tuberculosis, and even some systemic diseases can contribute to its development. In some cases, the cause remains unknown, termed idiopathic chylothorax. To understand chylothorax, we need to grasp its pathophysiology. The thoracic duct, which runs through the chest, collects lymph, a fluid rich in fats and proteins, from the intestines and other areas. When the thoracic duct or its tributaries are damaged, this tile, a milky white lymphatic fluid, leaks into the pleural space, the space between the lung and the chest wall. This fluid accumulation compresses the lung, hindering its ability to expand fully, leading to breathing difficulties and other complications. Chylothorax is a relatively rare condition. Its exact incidence is difficult to determine because many cases are secondary to other medical conditions or surgical procedures. It is most often observed following cardiothoracic surgery in adults and congenital heart defect repair in children. While it can occur at any age, certain causes, such as trauma, tend to be more prevalent in specific age groups. The signs and symptoms of chylothorax can vary depending on the amount of chyle accumulation and the underlying cause. Common symptoms include shortness of breath, chest pain or discomfort, and a persistent cough. Some individuals might experience fatigue, weight loss, or even malnutrition due to the loss of nutrients in the leaked chyle. In newborns with congenital chylothorax, respiratory distress can be severe and life-threatening. Diagnosing chylothorax typically involves a combination of imaging and fluid analysis. A chest X-ray or CT scan can reveal the presence of fluid in the pleural space. A thoracentesis, where a needle is inserted to drain the fluid, is then performed. The aspirated fluid is analyzed for its appearance, usually milky white, and its high triglyceride content confirms the diagnosis of chylothorax. Further investigations may be needed to identify the underlying cause, such as lymphangiography or MRI. While not strictly classified into distinct types, chylothorax is often categorized based on its etiology. We have traumatic chylothorax, arising from injury or surgery, and non-traumatic chylothorax, resulting from tumors, infections, or other medical conditions. Distinguishing between these categories is crucial for guiding treatment strategies. The treatment of chylothorax aims to control the chyle leak, drain the accumulated fluid, and address the underlying cause. Initial management often involves conservative measures like chest tube drainage to remove the chyle and nutritional support with a low-fat diet or total parenteral nutrition to reduce chyle production. Medications like octreotide can also be used to reduce lymphatic flow. If conservative measures fail, surgical interventions, such as thoracic duct ligation or pleurodesis, might be necessary to stop the leak and prevent fluid reaccumulation. Preventing chylothorax is not always possible, especially in cases of congenital abnormalities or spontaneous development. However, careful surgical techniques during cardiothoracic procedures can minimize the risk of traumatic chylothorax. Early diagnosis and treatment of underlying conditions like tumors or infections may also help prevent its occurrence. Maintaining a healthy lifestyle and avoiding chest trauma are general preventative measures. The prognosis of chylothorax depends on the underlying cause, the amount of chyle leakage, and the individual's overall health. With appropriate treatment, many individuals can recover fully. However, persistent or untreated chylothorax can lead to complications like malnutrition, immune deficiency, and respiratory failure. Recent research is focusing on developing less invasive surgical techniques and novel medications to improve the management of chylothorax and reduce the risk of long-term complications. Studies are also exploring the role of lymphatic imaging in identifying the site of the leak more precisely, leading to more targeted interventions.